Hello, my name is Nels Joslin. This is my presentation video. I'm going to show you a few of the tools that we'll be using to start an ultrasound guided IV. Great technological advancement in the 23 years that I've been in the business, because it just really helps get everything situated and the IV's in the correct spot. So this is a start pack. It has a lot of little things in it. We'll go over that. This is a J-loop, also called a pigtail in some places. This is a transfer device for our lab tubes that we use, and these are the lab tubes. So, and then normal saline to get all the blood out of the line after we pull our labs. So we'll get into this with the J-loop. We'll go ahead and put our transfer device onto the J-loop, so that way we're all ready to go when we get the IV inserted. This piece goes into the catheter on the IV, and this is where the tubes go to get the blood draws. Those are vacuum packed, so they pull the blood directly into it. Now the long part, let's go to the IV start pack. It's got a whole bunch of stuff in it. It's got some 2x2 gauze. It has an op site, which we put over the needle. It's got an antiseptic that we clean the area with before we do it, the venal puncture. It's got an alcohol prep pad just in case we need that. A tourniquet for tying over the arms and restricting the blood flow back into the body so we can get those veins plumped up. And a roll of tape. You always got to have tape. Oh, let's get into a ultrasound guided IV. Okay, here we are to do an ultrasound IV. Again, this is Nels Joslin, and I have a suspect over here that's willing to let me show you guys some things. So I'm looking at the screen right now, and you can see these two little dots here on the screen, and I'm going to press down. One of them will keep blinking, like this one here, and then this other one does not. That means that this one blinking is an artery, and we don't want to start an IV line there. This one is a vein, and that would be a good one to start, but it's kind of right near the artery, so we're going to look and see if we can find something else. Oh, here's a really big one right there. So this big one is a vein because it's not still pulsing. I'm going to go up just a little bit right there. And then this is where we are at on the arm down here. I'm going to clean off this jelly that I'm using to get through the skin. It's a conductive medium. And then I'm going to clean that. There's all of the stuff that I've mentioned in the video before this, and we're just going to get down right to it. So we're going to clean that off with a little bit of alcohol. We can blame it on the alcohol, baby. Okay, your son will appreciate that one because I know he's into music. Alrighty, so hopefully we'll be able to see everything, and I'll be able to show you everything that I've learned to do. So this little yellow arrow is the middle of this transducer, and then this is right underneath it all. So that's the vein I'm going to go for. So I'm going to line up the triangle and the vein, and then I'm going to line up my needle and the line there that makes it the middle. So I'm going to have a little poke on 3. 1, 2, and 3. You should be able to start to see the tissues kind of separate there a little bit. You can see where I'm poking here. So I'm right down on top of the vein. I'm going to push just a little bit more and see where we're at. So that little dot right there is the tip of my needle. You can see I'm moving the needle, and then you can see it there. So that's the very tip. So this is what I call chasing the lantern in the hallway, because this is your lantern and the vein's the hallway. So we're going to flatten our needle out like so, and then we're going to make sure it's still in the middle, and we're going to move the transducer just microscopically and then push the needle back into it. Now you see how the needle's going down into the bottom of the vein. So we're going to have to bring that up a little bit by bringing the base of the needle down, and keep just inching forward and trying to stay right in the middle. And so we still have the needle right in the middle of the vein, and we've gone in a fairly good amount. and this vein is very straight. So I'm going to just slide my catheter in like so. Now if I pull that needle out, it's going to bleed an awful lot. So what we're going to do is clean this off so that way I can get my sticker on it. But then I can also hang up the lots of pressure, bring that out, suck that down, get my J-loop with my transfer device on here. Put that in there, tighten this down. This is now I'm going to use my op sight here to secure this down, and that's going to hold it up against the skin. So now I have my transfer device on there, and I'm going to go ahead and take 1 vial of blood because I don't want to bleed this poor girl out. She's so nice to let me do this. So this is how we get our labs. We'll normally fill 4 to 5 of those with different things depending on what we're looking for. Then we can take that piece off, and we can use our normal saline and push that onto the end of here. Unhook this so that it gives her arm, makes her arm flow, the blood flow, and then we can clear all of the blood out of this tubing, and that's all cleared out and ready to go. And that is how we start an ultrasound guided IV.